that involves the great vessels. And whenever I talk about great vessels, I think कि आपके दिमाग में आना चाहिए कि सबसे बड़ी जो vessel है, that is a great saphenous vein, right? So whenever we talk about vessels, yes, but whenever we talk about the great vessel surgery, it involves the cardiac rehab. अब ये थोड़ी different बात है कि when you talk about cardiac rehab, तो नाम से तो ये लगता है कि कोई भी मसला जिसमें कोई भी ऐसी condition जिसमें दिल का मसला है, तो you are going to do the cardiac rehab. But I am saying vessel. So you have to just note this different point as well. Then आपके पास आ जाता है बच्चों congestive heart failure. One liner again, heart failure is a condition in which the demands are not met. We always talk about the supply and demand. The demand of the body is 5 liters of blood that should be circulating per minute. Aapka cardiac output should be 1 minute, 5 liters per minute. But if they, God forbid, a condition arrives in which the cardiac output is more than that required, and how it happens, your heart starts beating fast. It's not like you are just ingesting blood or you are drinking blood or you're drinking lots of water. It can be due to heart murmurs. It can be due to heart arrhythmias, any kind of arrhythmia. It can be tachyarrhythmia. It can be SVT. It can be any of the, PVCs. They can be PVCs. So basically, all of them lead to the congestive heart failure. And whenever someone is going through a congestive heart failure state, the cardiac rehab would be applicable. And last but not the least, the indication would be chronic stable angina. So the more medical term would be angina pectoris. And why we call it, again, there is a lot of detail to it. But the major thing is you have to differentiate between the stable angina and the unstable angina. I'm just going to give you a one-liner of it. You have to search it by yourself, or we can talk sometime later. That the test that differentiates both stable and unstable is EET. So basically, we are focusing on chronic, that is the phase, stable angina, that is the state. Okay? So whenever we are talking about angina pectoris, we are talking about the phase and the state. The phase would be chronic and the state would be stable. It would be our last indication to which the cardiac rehab can be applicable. अब आप देखिए, अगर आपको cardiac rehab के बारे में पता होगा, you will be able to treat all these 8 categories of patients. So it's not always about you are going. I talk to many of the, I think there's a dilemma in our society. People are just unaware about cardiac rehab. If you talk to them, okay, I am a cardiopulmonary physical therapist, they will think, okay, what you're going to do, आप जाने पॉड में, आप कपिंग करें, किसी को 1-2 कॉफ्स करा दी, और उसके बाद बहुत हो गया तो वाइब्रेटर यूज कर लिया, and that's all. So it's not all. Okay? If you are familiar and if you are knowing what is cardiac rehab, then you will only be able to implement your knowledge. Now, coming toward the contraindication, first of all is the unstable angina, any kind of unstable angina. If the patient is having any kind of uncontrollable arrhythmias, again, arrhythmias can be controllable and uncontrollable. और जो सबसे simple example है of uncontrollable arrhythmia, it is SVT. आपको पता होगा, ठीक है, because it is